Hi everyone, and welcome to the first online session for failure to function adequately, one of the definitions of abnormality that you need to know for paper 1. We can start with a quick introduction by completing this first task. So when an individual is not able to cope or function in everyday life, this is what we mean by failure to function adequately. So write down any areas of everyday life where someone may not be able to function adequately, causing concern for their welfare. So pause the video here for 2 minutes while you jot some suggestions down. So you may have included some of these on your list, but what do we actually mean by failing to function? So we mean that someone may not be able to cope or maintain everyday tasks such as these on the screen. For example, maintaining their own hygiene, keeping up with education, so going to college or school and doing the work, maintaining a job, so not arriving late all the time, actually being able to go to work, social networking, and by this we mean meeting up with friends and building relationships, and shopping so that they can take care of the basic needs of food and thirst, and so on. So well done if you got any of them in your own list. So how do we know someone is failing to cope? So Rosenhan and Seligman, they came up with some criteria that we can use to decide whether someone is failing to function adequately or not. This is just some of them. You can find more online or on the Tutor 2 website. So firstly, unpredictability. So if somebody is showing really impulsive, really uncontrollable behaviour, then this may be cause for concern. Maladaptive behaviours. So behaviours that are really unhelpful, but also go against accepted standards. Personal distress. So if somebody is experiencing excessive emotional responses, if someone's behaviour is causing them distress, then that is an indication that someone is failing to function adequately. Irrationality, unreasonable thinking and behaviour, and observer discomfort, which is causing other people to feel uncomfortable because of something that you're doing. And then one other thing to mention is that the Global Assessment of Functioning Scale, otherwise known as the Gaff, is a survey tool that is used between patients and medics to try and figure out just how much function has been lost and to look at the severity of a person's behaviour. So we've got quite a bit of detailed way, a bit of a holistic way of looking at somebody and deciding whether they're failing to function or not. So for this task, suggest maladaptive responses to the following scenarios, and if you're not familiar with the term maladaptive, then it's a really good opportunity to pause the video and have a look. So once you know what it is, pause the video and come up with some maladaptive responses to these 3 scenarios. Okay, so one really good way of looking at maladaptive behaviour is any behaviour that really is counterproductive, really unhelpful in the situation, extreme, irrational. So for example, failing a school test, a maladaptive response might be quitting, deciding to leave school, changing your career path, or actually an adaptive response would be to work a bit harder on the next one, get some feedback, have a look where you went wrong. You wave at someone and they don't see you and do not wave back. I'm sure we've all been there. An adaptive response would just be to think that they didn't see you, maybe they had their hands full, something to rationalise the situation. A maladaptive response might be starting to think that everyone hates you, no one likes you. You hear someone shout your name on the street, but you can't spot them. Again, an adaptive response, you might just not be able to see them, maybe it's busy, maybe they're far away. A maladaptive response, start thinking that a higher being is communicating with you. So now for another task, suggest examples of behaviours that could cause observer discomfort in others. And we mentioned just moments ago that this refers to when someone's behaviour causes other people discomfort. So suggest some examples of what could lead to this and pause the video for a couple of minutes while you jot your answers down. And some examples are on the screen. So well done if you mentioned any of these or if you come up with your own. So one thing we also mentioned before was the Gaff Scale. And this helps to quantify a person's functioning to identify the point that someone starts to fail to function. So on this scale, a low score indicates severe failure to function and a high score suggests that someone is functioning fine. So your task, and the final task for this session, is to suggest what the criteria could be at each score and bracket. So if somebody was going to score 10 to 0, what type of behaviours do you think they would have to exhibit in order to be given this most severe score? Pause the video for 10 minutes while you have a think, jot your answers down. So someone with the highest score might have absent or minimal symptoms and functions not a problem. Someone with an extremely low score, they may be given this rating because the persistent danger of severely hurting themselves or others, they've an inability to care for themselves, or maybe they are demonstrating suicidal behaviours, thoughts, attempts. So we can see why that would be our most severe score. And then in the middle, we can see that there are some serious concerns, but not as serious as those on the lower end.